viewers, hamjambo. I'm glad that you found time to come and watch this video on Grace the Nurse YouTube channel. In case you've got any question, feel free to ask on the same channel. As we said, we are talking about mother and child health care, and our topic today is on care during pregnancy. So, care during pregnancy has got two things. Number one are the actions that you're supposed to take and the things to observe when you become pregnant. So what are these actions that somebody is supposed to take? Eat one extra meal every day during pregnancy. If your habit is eating one meal or 2 meals, when you become pregnant, you have to eat one extra meal. Why? Because you are feeding for yourself and for the baby. Number 2, you are supposed to eat plenty of fruits and vegetables. We know fruits are source of vitamins, whereas vegetables are source of refuge. We know what vitamins do to our bodies and what refuge does to our body. The vitamins are for prevention of diseases, and the refuges are for softening the stool. So they are very important to be taken when one becomes pregnant. Another thing somebody is supposed to do is to take iron and folic acid tablets, which usually mothers call the IFAS. The importance of this medication is that they boost the blood in the body, and also they help in the development of the backbone of the baby. So immediately a mother realizes that she's pregnant, she's supposed to swallow the IFAS tablet. And IFAS has got to have 2 tablets, the iron and the folic tablet. Very, very important. Another thing a mother is supposed to take action on is avoiding to do heavy work and rest more. Heavy work is like what? Mothers, we are used to carrying heavy loads, either on our hands or on our back. These things we are told when we become pregnant, we try to avoid. That is heavy work and we rest more. We are also advised to sleep under an insecticide-treated bed net. Why? Because mosquitoes are very dangerous. They carry malaria. And a pregnant mother, they say, when she's pregnant, she emits a certain chemical which attracts mosquitoes. And mosquito, as we have said, they are the media for transmission of the malaria disease, which a mother should not expose herself to. That's why she's being advised to sleep under an insecticide-treated net. If not the net, then make sure the room you are sleeping, there is no mosquitoes. Another thing a mother is advised to do is to go to ANC visit as soon as possible, and at least 4 times during the pregnancy. ANC means what? Antenatal care. So when a mother realizes that she has become pregnant, she's supposed to start going for ANC clinic as early as possible, as soon as she realizes she's pregnant. Why? Because some things happen in the clinic. A mother is taken to the laboratory, like we mentioned in the last time, where profiling is done. Urine is tested, blood is tested. A mother is also vaccinated. She's giving a vaccine which we call the tetanus toxoid vaccine. Another thing, her blood pressure is monitored, which is very important. In case the medical personnel realizes the pressure is not within the normal range, the mother is referred to the doctor for further attention. Another thing is, we monitor the weight. Remember, when you become pregnant, your weight is supposed to increase. So in case there is a problem and the weight is not progressing as expected, investigations are done to know why the weight is not increasing. Another thing that is done is assessing the mother and the baby. For those who have studied the clinic, they know when a mother comes to the clinic, usually they tell them to lie on a couch, whereby we assess her from head to toe, and we also assess the baby in the uterus. So those are the things that the actions that a mother is supposed to take when she becomes pregnant. That is eating one extra meal every day, eating plenty of fruits and vegetables, taking iron and folic acid tablets, avoiding heavy work and resting more, sleeping under an insecticide-treated bed net, going for ANC visit as soon as possible and at least 4 times during the pregnancy. Now, about the things to observe. The things to observe, in other terms, they are called the danger signs during pregnancy. When a mother becomes pregnant, she's supposed to observe herself for any danger sign. Which are these danger signs? Number 1, it is any vaginal bleeding. Any bleeding to a pregnant mother is a danger sign. Another thing to observe is any severe abdominal pain. If a mother develops abdominal pain when she's pregnant, something is wrong and she's supposed to be attended. Another thing to observe is any severe headache. A mother, when she's pregnant, she's not supposed to have any headache. So if she develops severe headache, she's supposed to be attended. Then a mother becoming pale. Pale means what? When you are seated with another person, if you check your palms and you realize that your palms are becoming white or pale comparing to the other person, you are becoming pale, you need to be attended. That is, the blood is supposed to be assessed. Could be it has gone down. Another thing to observe is any fever. Fever means body temperature going higher than normal. How do you know that the temperature is high? If you just touch yourself, you are feeling like you are hot, or even when you stay like this, you feel like your body temperature is not okay, you are supposed to be checked. Another thing a mother is supposed to look out for is reduced or no fetal movement. When the baby starts developing in the uterus, it starts moving. And anytime that movement ceases, then there is a problem, you are supposed to be assessed. Some other things that also a mother is supposed to look out for is breaking of waters. We mothers, we know when the baby is being delivered, some foul water comes. But in case it comes before the period of delivery has come, one is supposed to be checked. Another thing is getting tired easily. A mother who is pregnant is not supposed to get tired. So anytime that you feel that you are getting tired, you are supposed to be assessed. Another thing to assess is swelling of the face and hands. Sometimes you might hear a friend telling you, why does your face look like a moon? We call it moon face. Means that there is swelling. Another thing is being breathless. That is, you walk, as you move, you feel like you are getting out of air. That is becoming breathless. You are supposed to be checked. So, you are supposed to be prepared, always observing these things, so that you are able to attend the facility, a health facility of your choice, for you to be checked by a skilled health worker. And then also be prepared with your birth plan, like we talked about it the other time, whereby you are supposed to know where to deliver, transport to take you to the hospital, birth companion, and also the money that we talked about, you have saved. So for all this information on care during pregnancy, we said that we are referring from the MOH to 16. So if you have your booklet, you just need to go back to it and you refer. In case of any question, like I've said, you are supposed to ask me through Grace the Nurse YouTube channel. Thank you.